Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today my video will be speaking about how to take the pain history from your patients in a simple and very easy way. But before we continue, if you are new to the channel, make sure to subscribe down below for more and more videos. So let's start now. Now, in the dental history, the two most important diagnoses that should be written down is either the patient is having reversible pulpitis or irreversible pulpitis. Now, the way to differentiate between them is that under the reversible pulpitis, the patient will have pain on cold or sweet. Now, they will tell you that whenever I eat ice cream, I have pain. Whenever I eat any sweets, I have pain. In addition to that, the pain disappears as soon as the stimulus is removed. What do I mean? When the patient eats ice cream and he quit eating it, as soon as he removes the ice cream from his mouth, the pain will disappear. And lastly is there is no spontaneous pain, meaning that the pain, it arises from a non-reason. If you are eating something cold or sweet, it does not come spontaneously. Whereas in the other hand, the pain of irreversible pulpitis is quite severe. Pain on hot and cold. They will tell you that whenever I eat something cold, whenever I eat something hot, I have a very severe pain. The most important thing, under the irreversible pulpitis, the patient will have pain on hot things. If they say I have pain on cold only, then that is reversible pulpitis. If the patient says that I have pain on hot and cold, then that is irreversible pulpitis, or hot alone, irreversible pulpitis. Not only that, the patient, he drink a soup, and this soup is very hot. He end up having pain, and this pain, even if you quit eating your soup, you will have this pain continuous for a period of more than 15 seconds. So it is referred to as lingering pain, which is pain of longer duration in comparison with the pain of reversible pulpitis. And lastly, they will say, I have spontaneous pain. What do I mean by spontaneous pain? Meaning that suddenly I have a pain, doctor. For no reason, I did not eat anything, I did not do anything, and I have a very severe pain. That is what is meant by the spontaneous pain. And always remember that if you see such a patient in this picture, having a plastic bag that is filled with ice, or an ice bag, and they put it on their face in order to relieve their symptoms, always remember that the patient is having irreversible pulpitis, and they put something cold, because the cold, it acts as a vasoconstriction, so it will help to reduce the inflammation, meaning that it will help to reduce the symptoms of your patient. So they will tell you that whenever I place something cold, the pain will start to reduce. But whenever I drink something cold, or whenever I drink something hot, I will have a very severe pain. Now, if you cannot remember any of what I said before, there is an easy way to differentiate or to distinguish between the reversible and the irreversible pulpitis in terms of night pain. Now, if the patient, he tells you that I cannot sleep at night, then that would definitely be irreversible pulpitis. If the patient tells you that my pain is not affected, I can sleep at night, then that would be reversible pulpitis, definitely. So that is the very simple way to differentiate between them in terms of night pain. Now you might ask me what I can see if I take a periapical x-ray for my patient. Under this periapical x-ray, you can see there is an filling, and this filling is radiopaque. Radiopaque meaning that an amalgam filling was placed on the patient. Now, if the filling is limited to the dentine only, as you can see in the picture, the filling is limited to the dentine, it did not reach the pulp, the diagnosis would be reversible pulpitis. On the other hand, this picture you can see the radiolucency is not only in the dentine, it has extended into the pulpal tissue or into the pulp. Because of that, the diagnosis definitely it would be irreversible pulpitis. Thank you all for watching my video. If you have any questions, please do write it down in the comment section below. And don't forget to subscribe for more and more videos. Goodbye now.